The care of the diabetic is a complex thing. Diabetes is not a problem with sugar, as many people think. Diabetes is really a problem that affects all organ systems, and one of the ones that it affects predominantly and more severely is the foot. Because they have poor sensation to the foot, they don't notice when they get cuts and when they get scrapes and when they get little ulcers. Once that's identified, because they have poor blood flow to the feet, those ulcers, those scrapes don't heal appropriately. So what you wind up with is a foot that's injured, it's not healing adequately, and we wind up having a lot of toe and foot amputations as a result. So today we've been running a diabetic foot exam clinic. The idea being that every diabetic should get a comprehensive foot exam at least once a year. So we've brought in our diabetics that are needing foot exams, and we've tag teamed with the health educators so that not only do the patients get a comprehensive foot exam, they get some education on how to care for their feet as well. The foot exam involves, first of all, an inspection of the foot. Looking at the skin, looking for any lesions, making sure there's no abnormal thickening of the skin. We look at the nails. Nails that might need trimming will get trimmed. Then we take the pulses, make sure that the blood flow is appropriate for the foot. Then we test their sensation to the foot. We see how well they can perceive a mild prick with a nylon cord, and then we test the sense of vibration. Once that's done, then we show the diabetics how to use a mirror to examine the bottom of their feet. Then we take a pumice stone, show them, and we'll actually do it with them, how to remove the rough skin on their feet. Finally, after their feet are dry, we go ahead and put some moisturizing cream on their feet to ensure that they know how to do that. Once that's done, then the diabetic educator will come in and give them some equipment to take home that includes nail files, toenail trimmers. They will give them socks to wear so that at bedtime, after they put their lotion on, they can put a sock on to keep the lotion on their skin. The most of what we've seen, actually, feet have been pretty good. A couple of patients with abnormally thick nails that we've had to trim, but what we've seen the most is the dry skin and the callus formation on the soles of their feet that comes from improper footwear or not wearing footwear at all. So we made sure that they understand that they can't walk around barefoot, that they have to wear a good fitting shoe. They can't wear tight shoes. They can't wear sandals that expose the toes as people like to do during the summer. We had a couple of patients that came in and their sugars were abnormally high because we've checked everybody's sugars. They come in. So what we've done is, once the foot exam was over, we immediately passed them over to our PA to take care of the acute medical problem. And we've also managed to have our medical students participate in this to show them the importance when they go out of doing that type of exam and being vigilant for the foot conditions in the diabetics.
My name is Paul Hernandez. I'm a third-year medical student from the UT Health Science Center here in San Antonio, and I'm doing my family medicine clerkship here at the clinic. So this morning we did the diabetic foot examination clinic. All the patients that we saw this morning were due for their yearly diabetic foot exam. So I had an opportunity to participate and conduct some of those examinations. It's a great opportunity to get some hands-on exposure and one-on-one time with the patient and learn about the proper foot care in a diabetic. You know, and that has given me that perspective on family medicine that you're not treating just one thing one day, you know, you're really following the patient over time.